Hello, everyone. I'm Solomay Tibabu. I'm the host of Going Digital Behavioral Health Tech, and I'm really looking forward to this conversation with Carrie from Mercer to discuss employee mental health. Carrie, thanks so much for being here. Perhaps you can give us a brief introduction about yourself and Mercer, please.
Absolutely. Thanks so much, Solomay. My name is Carrie Bergen, and I'm a senior behavioral health management consultant at Mercer. I sit within our total health management team. I'm a licensed clinical social worker, and I've been in the mental health industry for 20 years now. And my experience ranges from direct therapy, clinical management, account executive work in both public and private sectors. In my work at Mercer, I really focus on strategic program design, implementation and management of behavioral health programs, including EAPs, mental health and substance use services, and other types of point solutions that are integrated within an organization's benefit ecosystem. And I really strive to work with my clients to design cost-effective and manageable behavioral health solutions that are clinically effective, accessible, and also easy to navigate for the member. And Mercer is a part of Marsh McLennan, which is a global professional services firm that's headquartered in New York City. We have businesses in insurance brokerage, risk management, reinsurance services, talent management, investment advisory, and management consulting. So there's a lot that Marsh McLennan does. And within that, Mercer is a recognized leader in the health and benefits marketplace globally. We deliver really innovative solutions that address the health and wellness needs of our clients and their employees. And we work with small businesses, domestic employers, large multinational firms, and deliver a really comprehensive array of health and benefit solutions. And we have local market experts, as well as national and international resources that advise on all types of business practices like regulatory compliance, and then innovative benefit strategy, which is where the total health management team falls into, and the work that I do. So within total health management, I really provide a subject matter expertise around behavioral health using my background and experience to help support our clients. So thanks so much for having me. Really looking forward to the discussion today.
Thanks. And for those who are unfamiliar, what is Mercer?
So Mercer is part of Marsh McLennan, which is a global professional services firm that's headquartered in New York City. With businesses in insurance brokerage, risk management, reinsurance services, talent management, all kinds of things. And one of those pieces is management consulting. And Mercer, as part of the consulting business, we work in health and benefits globally and domestically. And we deliver innovative solutions that address the health and wellness needs of our clients and their employees. So we work with small businesses, multinational firms, large businesses, and really focus on delivering an array of health benefit solutions. We have a really large team of different types of experts. And as I had said, I sit within our total health management team, solely focused on behavioral health as a subject matter expert with my background.
Great. Thanks so much. So I'd love to just jump right in. What are some of the biggest challenges that your employer clients are currently trying to address as it relates to behavioral health specifically and their employees? And what advice could you offer them?
Yeah, I think we've seen such a need for additional mental health solutions and providers as a result of COVID and the geopolitical and social events that have taken place in the last couple of years. And people have delayed care. And so symptoms have exacerbated. They are now seeking care that sometimes needs a higher level of care versus somebody that could have gone to outpatient a couple of years ago, and now they're needing an intensive outpatient program, things like that. And so as people are coming and there's this call to action for increased access, one of the biggest challenges is the overall member experience. And so building that seamless member experience and offering easy navigation, I think, is one of the biggest challenges that the vendors are trying to overcome. Also offering high quality providers with increased access that I had talked about but not just to any provider, to providers who will really meet the need of the member. And then also integration with the other benefits that are available in the client's ecosystem. Oftentimes we work with clients who have an array of amazing benefits, but there are so many that individuals don't really know where to go to first. They don't know the difference between one versus the other and what would be a better fit for them or is going to meet their need in the best way. And so that navigation is really a key piece. Also, claim spend, we're seeing providers increasing their rates, which is increasing behavioral health claims cost, reducing stigma. I talk a lot about some of the positives, if we could, or the silver lining that have come out of COVID. And I think that because mental health is being talked about in such a different way, it's really helped with reducing stigma, but we still have such a ways to go. I would love to see the day where we're able to talk about mental health in the same way that we talk about physical health. So someone's out of work for, a few days because they had a cold, they had COVID even, people ask, how are you doing? Are you feeling better? Do you need anything? I would love to see someone who's maybe experiencing depression or anxiety and has shared that receive the same type of response and reception from friends, coworkers, and just society at large. And then I think lastly, global parity is also very key. As we look at multinational firms that have both US domestic employees as well as international, having benefits that really focus on behavioral health that have that equality is key, because we don't want people to feel as though they're not receiving something because of where they live. But of course, laws look different within mental health across the world. But there's a lot of organizations that are really trying to solve for global parity and having equal services that are being provided.
And what have you and your colleagues at Mercer learned in the last couple of years when it comes to implementing some of these scalable mental health solutions quickly and effectively?
I think so. We're seeing really the need to start with the basics, if you will. So evaluating what services are currently in place to create that baseline. And we use qualitative and quantitative to do that. Getting feedback from employees is really beneficial. So having fireside chats or focus groups to understand what their needs are. Sometimes leaders have a very different perception of what their employees need versus what the employees think they need themselves. And then also the data to support that, whether it be from medical claims or utilization data or the EAP or any other behavioral health program data. But it helps us to determine what is the client trying to solve for, the organization trying to solve for. There's some key areas that we also consider when looking at the medical claims data, and that includes ABA or applied behavior analysis spend, substance use disorder versus mental health. So that can help us drill down into specialty programs that might be needed. And then we also look at vendor experience and fit. Do the vendors that we're evaluating offer services that are going to create the ideal emotional well-being culture for the organization and fit within the client's priorities? Really getting in stakeholder and leadership buy-in, and then also helping to socialize, what that means, what that'll look like, the accessibility of the services, what the promotion will be of the services, and what that employer lift will be, because there are so many competing priorities within the space. Having a vendor that can really stand up the program quickly and effectively without it taking a lot of bandwidth from the benefits team is really important to a lot of organizations, as it should be.
Thanks so much. Now, at this point, through COVID, employers might have already implemented some kind of solution. And so for those employers in the audience that have somewhat of a portfolio, I'd like to know, what should they be thinking about to ensure that they're getting the maximum ROI from the investment they've made these last few years?
That's a great question. I think that continuing to monitor that baseline, and monitoring the data is key. So doing something like a gap analysis where you're looking at all of the data that's available from the different programs and understanding where key pieces might be missing, or if there's overlap of services. As I was saying, sometimes there are competing services that are doing very similar types of services or support. And so really gauging, are these still the right programs to have in place, and are they meeting the member needs? And with that ongoing data analysis, that can really help to show where the usage is, where there may be different needs. And then also the cost effectiveness. Are you seeing that return on investment that you expected to see where you have a program in place? Is it reducing maybe the medical spend? And so having that be top of mind. And then I also think, as vendors continue to evolve and innovate, making sure that you have a full understanding of what's new, what's capable, and really having a strategic partner within your vendors as well. So as they're evaluating the usage of the services and the outcomes as well, are they able to pivot and be flexible to continue to meet your needs? And with that, having strong integration amongst the benefit vendors in your ecosystem. So that can look like ongoing cross-training between the two, making sure that those referral pathways are very clear and open, and that if a member comes into one vendor, that vendor has a great understanding of what else is available from the organization so that they can really seamlessly be referred over and connected with those other layers of care or service support.
Speaking of other vendors and competition, have you found that employers are even starting to switch to other benefits and programs post-COVID, or are solutions pretty sticky once they're invested?
I would say we're seeing an increase that is probably more impactful than we've seen in many, many years. And because of the needs arising from COVID, as I was talking about, employers are absolutely starting to switch to other benefits. Mercer did a national survey, and we found that more than 70% of employers have focused on expanding behavioral access in their strategic roadmaps for the near future, as well as through years 3 and 5. So it's definitely something that's top of mind for employers. We're also seeing a real focus on flexibility of work in response to reducing burnout, retention of employees. We've gotten used to, those of us that have been working from home, being in the home office. And so trying to allow employees as much as possible to really work when they can work and be home when they need to be home, and having more flexibility there. And then we're also seeing within the millennial population, especially, that mental health benefits is the number one attractor for that population. And in exit interviews that we've collected from our client groups, that millennials are saying the number one reason that they're leaving is to look for an organization that offers better mental health benefits. So it's also a really key retention within certain populations, as well as parents and caregivers of children with mental health issues. That's also very key, is to have strong mental health benefits. And then, employees are also really looking at virtual care options in a different way. We saw at the beginning of the pandemic this flip where it really did a 180 of people who were seeing in-person mental health providers going to primarily virtual. And now, as we're coming out of COVID, we're expecting that to balance a little bit more, where we're going to see about half and half of individuals wanting in-person versus virtual. And so having really good virtual care offerings in place is critical for employers.
Wow, those are some astounding next generation Gen Z millennial stats. And so times are changing, which I think is exciting in many ways. And you mentioned earlier, vendor experience and fit is something you help your clients with. We've got quite a few digital health startups and telehealth vendors in the audience. Do you have any advice for them on how they could be successful in partnering with employers?
Sure. I think that really creating the story of how they can solve differently than vendors that have been tenured in the space and successful in the space. How is the startup coming to the table to offer something new and highlight the differentiators of their services as well as return on investment? I think a lot of employers are very interested in understanding if they're going to be spending more money and including mental health as a top priority within their benefits budget, what is that going to do for the organization as well as their members, and why are they a better solution? So as we've seen digital innovation take place, digital access to assessment and triage. So instead of having to call in for services, individuals who can go onto the vendor's platform, that's really creating ease of access. And things like online scheduling and the capability to review the specialization and background of providers is something that's new and really exciting. And I think as we're moving into this digital world, it's something that really is needed as well. And then also, really having strong focus on building more diversified networks as well. So not only race and ethnicity of providers, which is critical, but also specialization of treatment areas. So is there capability to focus on children and adolescents or substance use disorder, racial trauma, things like that? And then navigation and concierge offerings are also an additional layer of support and follow up to assure seamless member experience. So I think as new players are coming into the space, whether they be a startup or a traditional vendor that's really trying to make enhancements, those are all key critical areas that need focus as we move forward within behavioral health and the needs of employee populations.
Thanks so much, Carrie. That's really great advice for newcomers as well as established vendors alike. So I wish we had more time, but I'm going to have to ask maybe just one more question. And I want to focus in on this issue around burnout. At this point, through several years of the pandemic, this is a huge problem. Do you have any advice for employers and how they can support employees with burnout?
Sure. And I think it's a great question. We are hearing more and more from employees that participate in our studies that burnout has gotten worse over the last couple of years. And there was a 2021 survey from Indeed actually that showed that 67% of workers believe that burnout has worsened during the pandemic. So that is such a staggering number. And I think, when we talk about burnout, it's oftentimes confused with personal stress. And so I think it's helpful to share that the ICD definition of burnout is actually an occupational phenomenon. And burnout's a syndrome of conceptualized as resulting from chronic workplace stress that has not been successfully managed. And the way it can show up is really feeling energy depletion or exhausted, feeling this mental distance from your job, or feelings of negativism or cynicism related to your job, and then reduced professional efficacy. So I say that just because people will sometimes say, I'm so burnt out. And we look to the individual sometimes to try to change that. And it's not an individual issue. It's very much an organizational culture issue. And so as we acknowledge that and think about burnout and what causes it, it's kind of lack of connection, especially those of us in virtual environments, unsustainable workloads, people who feel like there's a lack of reward for their work, either financial or emotional, and then lack of values alignment and feeling included. And so companies are really tasked with this challenging problem. But when we think about who's responsible for addressing this, it really needs to come from leadership and management and then trickle down. And we need to empower and educate that it's not just HR's problem. It's kind of everybody within the organization. And, I had mentioned flexible work time. That is definitely something that can help, and also encouraging time off if possible. Embracing work-life balance. So allowing people, to spend time with family and loved ones during the day, even, and then coming back to work. So flexibility within the workplace is key. And then, of course, benefits can certainly help. So offering mental health benefits. There's a lot of organizations that are doing great work within company culture training as well. So teaching management emotional resiliency and how to kind of take care of themselves as well as taking care of their employees, creating that connection that I talked about. So things like chat sessions, fireside chats, manager training is really, really important, and giving managers the tools to talk about mental health comfortably. And then getting employee feedback to really drive how you're shifting the culture and putting benefits in place to address what they're experiencing.
Thanks so much. I'm really glad that you put it that way. I think oftentimes when we talk about burnout, we put too much emphasis and pressure on the employee to help themselves. But you're right that as employers and leaders, it's really up to us to make the change happen, and we can. So thank you for that. This has been really excellent. Really appreciate your time as always. And everyone, please follow up, learn more about all of the amazing resources that Mercer has to offer. Go to their website. They've got many tools for employers, such as their Good Work framework. And again, thanks so much, Carrie.
Thanks so much, Salome.